Hey, it's Dr. Dan here, and I'm going to talk today about sacred cows. A very interesting phenomenon. You notice probably sometimes in life, having a discussion with somebody, the easiest sacred cows, of course, to mention are politics and religion. Everybody seems to have a hot button there. I get it, myself included, which is why we tend to avoid those conversations, even though we shouldn't, because discussion is the key to understanding. But that's just the way we're trained. Well, I don't know well, I would assume that we're meant to be in disagreement instead of finding agreement or common ground. That being said, in healthcare, there are absolutely sacred cows, and physicians fall in that group. I wouldn't consider myself that way because my career started as a chiropractor, and of course, we all know that chiropractors have significant brand equity, meaning there's always been some sort of thing that, chiropractors aren't real doctors or chiropractors are quacks, which I just don't really care about because it doesn't matter to me. I'm here to help people like you that are watching this video. However, when it comes to MDs, it's a very different phenomenon. And I bring this up because yesterday I was having a discussion with a patient who has a medical condition and actually does need interventions and medication. However, when I brought up the possibility that there were some things on the lifestyle side that she could do to improve her status or situation and potentially reduce her dependence on medications, because some of the levels that she had were higher than they should be, especially considering that they were supposedly being managed with medication. She got a little bit weird. I just watched her change. She's like drew back, crossed her arms, and then said, well, my doctor told me that I'm doing everything right. And I know other people in her situation who don't eat the way she does and are in a better situation and are at a decreased risk of having future problems down the road. And I am being very careful because I don't want this to, reality is some people, it will strike the wrong way. Some people, when it comes to medicine and their physicians, aren't willing to consider any sort of alternative viewpoint. And if that's the case, then, what our office offers isn't going to be helpful, because if somebody's provided with information that they refuse to consider, then they won't get better. And that goes to that thing that I noticed with, when we first started doing neuropathy over a year ago, that people would come in and they had this like kind of I could just sense this built-in resistance to what I was saying about us being able to help with neuropathy. And even cure it in most cases, depending on where they were in terms of their progression. And it was, it watched the same kind of body language, the drawing back, the arms crossing, and it was very odd until I started asking out because I didn't understand it. So as soon as it started happening and I was a little more keyed into it, I was like, what's going on? What have you heard? And, everybody, literally every patient said the same thing. Well, my doctor told me that it's incurable, that it can't be cured. And, it's interesting because they never thought to question their doctor. Not once. None of them said, "Yeah, that didn't sound right to me," or he said that. Now, granted, they're still at our office, because they're looking for help, but in the back of their minds, they're still thinking there is no way out for me. And when I talk about sacred cows, I would not want to be anybody's sacred cow. I don't want to be, the definition for sacred cow is unreasonably immune from criticism. Look, if I'm making mistakes or I need to do better, I want to hear it. I want to know, as would anybody I would expect who is patient patient-driven. All I care about is the results for the patient. That's the most important thing to me. So when we're going through any sort of medical situation or having some sort of health crisis, it is extremely important to question things. And that doesn't, questioning things doesn't mean that you're fighting, or it's normal to have questions. It's good to have questions. Now, if there's something that's not working, you definitely need to question it. If you look at it as something else and you're seeing that the results are always clear and that the protocols that are laid out for that situation show great results, then the only question is what's holding you back. So again, important to kind of notice of yourself, and I need to pay attention to myself sometimes when I'm getting into discussions about certain things. I find myself getting kind of like worked up and tense, clenching the jaw. That's a sign that it's a belief being challenged and not a truth, because people will vigorously, myself included, vigorously defend their beliefs, as opposed to when we get into some sort of factual discussion and it's very just frank and direct and straightforward, and we don't try and tie emotions to those things, then you're going to find that there's a better exchange of ideas, a better understanding, a better grasp of what's going on. And really that's our goal, or that's my goal, both as a person and as a healthcare provider, is to get around all those things that seem to have been installed and create resistance to forward progress to health and development. And that's certainly not an easy thing. I can't control others' psyche. I can only control my own. And that's a challenge enough, to be honest with you, at times. But it's just another thing to think about. If you're looking at a situation, you step back and you're kind of viewing yourself as a third person, like, am I responding or am I reacting? Response is thoughtful. It takes time to consider. It's not a reaction, versus reaction is you're just sitting there waiting for the other person to get done talking so that you can throw out what you want to say, as opposed to, okay, what are they really trying to say? What's really going on? What's really driving this? What's happening here? And then best case is that you mirror back. So what I'm hearing is bop, 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 bop. And then once you get their agreement that like you've accurately summarized their thoughts or feelings on the matter, then you can provide your input, assuming it's desired. Yesterday, like I said, the interaction with my patient, it was, she just clamped down. I can't remember exactly what she said, but something to the effect like, I feel like you're trying to tell me what to do. I was big eyes on my face. I was a little confused. I was like, I don't know how we basically went from 0 to 100 just like that. And it was confusing for me. And then I realized what had happened is that I had questioned one of the physicians on her healthcare team, and she was not having it. There was no way that I, either due to my lack of status, because I'm just somebody who does physical medicine in her eyes, or because of the things that are built in, maybe a little bit of fear that she's getting bad information and that she doesn't want to hear the truth. That happens. I can't speak to what it was. It was just very dramatic and basically became, I was just asking questions. I'd never asked questions about her condition, deeper questions about her condition before. And I wanted to understand, because anything I can learn from her, I might be able to apply for other patients, or might give me a better understanding of what's going on for other patients. That it did not work out that way, to say the least, which is fine. That's just the way it goes sometimes. I'm not here to please people by any means. I'm not obviously going out of my way to upset or insult people. That's certainly not my goal. I'm just trying to understand what's happening and trying to provide the best service possible, and trying to learn as much as possible so that I can provide better for other people, including, obviously, of course, the people that I'm speaking with. And so it was just an interesting experience, and kind of highlighted that it's not as simple as knowing what to do. A younger me probably would have become a little bit more combative, to try and defend my position, which was like I was just asking questions. Instead, I just let her go. She may or may not come back. That's fine. She's been with us for over 3 years in a maintenance condition. Took her out of severe pain, just feeling great, back to activity, no problems, and just doing occasional maintenance. And so if she goes, she goes. Again, I'm not going to get emotional about it. There are just many more patients behind her, so that's not the issue. It would be a shame because she does need the ongoing maintenance because of other conditions she has in terms of her spine. But it is what it is. So if you're not willing to consider other viewpoints and you're not willing to kind of look at information to try and understand, is everything I'm being told to me correct? Am I understanding this correctly? Do I understand my situation, my actual situation correctly? Because if you don't know where you're starting, then it's certainly very difficult to understand where you need to go. You're kind of lost. You're operating without a map or an understanding of which direction needs to be taken to get you to the best possible place. And so, again, bringing it back to my type 2 diabetes patients, my leaky gut autoimmune patients, my neuropathy patients, a lot of them don't understand where they're at. Fortunately, I have gotten better at communicating and understanding what needs to happen to kind of take them from where they're at to a higher level of understanding, so they can make better decisions for themselves. Because I'm not here I can't force anybody, and I'm not interested in that either, but I can't force anybody to do anything. I can't push anybody in the right direction, nor do I want to do that. I want people pulling me. Say, hey doc, let's go. I get it now. This is what makes sense for me. Let's move forward. Because success, speaks for itself. Our results in the type 2 diabetes and the neuropathy area is incredibly high. It's over 95%, I would say. I think it's almost 97% or right around 97%. So what we're doing works. I know it works. I see it every day. And again, I'm happy that it works as well as it does. A large part of that, again, though, falls on the patient. You has to understand what's happening to their bodies, how they got in the situation they got, and what needs to be done to get out of that. And that's where we come in, is for those people who've reached that point, is to provide them with the information and the guidance so that it can make it easier to become successful in achieving their goals. Okay, that's it. No more talk about sacred cows today. Everybody have a great day. Thanks for listening.